Name is Rebecca Agnew, and we are looking at cases whether we are defending the defendant or the plaintiff in this case. And the case that I was presented was hospitals implementing new methods and necessary policies for telephone messages that are left for patients. And the defendant is Beverly from St. Ashford Hospital, and then the plaintiff is Jacob Jones. And in this case particularly, I am actually for the plaintiff. I do understand the mistake that Beverly made in this case, but unfortunately, it's a HIPAA is a huge rule, and unfortunately, she did violate that by leaving a public message on a public machine. The case is the fact that Beverly from St. Ashford Hospital called Jacob Jones's number on file. That actually led to a voicemail that the daughter ended up hearing about a very detailed report on the history and conditions and procedures and things and such that the patient went through. And these were not supposed to be disclosed to any family members whatsoever. And Beverly was even specifically told to leave that voice message through a work number so that this specific thing would not happen. And unfortunately, with HIPAA, this is something that does get violated quite often. I worked in the field for 16 years and in the field of OBGYN, and there are many, many cases where we have to buckle down and really make sure that we're, keeping the patient's privacy completely 100% private, and all their health information. Every patient, when they come in, they sign something saying whether, certain people are allowed to hear certain documents and what phone numbers and specific details of where we can leave private information or a message for them to call back to get more information themselves. And the fact that Beverly left that message on a voicemail that Jacob Jones, the plaintiff's asked, specifically said not to leave it on, but to leave it on her or on the work phone was, unfortunately, Beverly did violate the Privacy Act, and that can cost a lot of money. I mean, you can even go to certain hospitals or doctor's offices, and they usually have sign-in sheets that they have to, there are even HIPAA compliant sign-in sheets, and I've even gone to doctor's offices and they're not compliant as well. But I've been in the field for a long time, and we get checked constantly. I mean, you can't even have the name of the patient on both sides of a chart, because even if you flip it over, they can still see the name on the other side. I mean, if another patient comes up and sees another patient's chart, that's a complete violation. Another example would be if you're in the lobby and the front staff is talking a little too loud and you happen to overhear them calling you medications or trying to get a procedure authorized or medications authorized and things like that. That's also another violation for the fact that someone in the lobby can hear another person's name because no information is supposed to be disclosed. And it's even more so with hospitals and things like that. And in Beverly's case, she unfortunately violated it by saying too much information on the live voicemail rather than leaving it in a private message, which the plaintiff clearly stated beforehand, and unfortunately she did not follow through in that. I mean, it's an honest mistake. A lot of people do things with HIPAA, and unfortunately, being in the field I've been in, I have seen a lot of mistakes and things left out. I mean, even something as simple as a doctor looking at a report and signing it and just leaving that paper there, and the next patient that comes out of a room happens to see that. I mean, even if it's a glance, and that particular paper means absolutely nothing to that patient, it's still a violation of their privacy, because there is that woulda, coulda, shoulda. I mean, we already get patients that kind of come in and out of our own office that happen to know each other, and it's like one sees the other one and expects, oh, she must be pregnant if she's here, and she hasn't even said it to anybody. And I mean, we're not supposed to disclose that kind of information. We've even have had mothers and daughters that have both been pregnant at the same time, and the daughters, knowing that they're pregnant, we have to try and coordinate as much as possible to make sure that they don't have appointments on the same days. But at the same time, knowing, I mean, in one specific case I'm thinking of, that this mother used to come in all the time and talk about her kids, and we had to sit here and completely not even mention her daughter, and not even knowing that she was going to become a grandmother soon. But these, again, are things that the workforce in the healthcare industry really has to work towards, especially if you're working towards family practice or OBGYN, or if you're working in the local community. A lot of people end up knowing a lot of people, so you have to work your butt off to try and keep those things private. So I will have to say here on the policy for the telephone messages that I think Beverly should, when you usually leave a message, I mean, from the healthcare industry side, it really is the most basic. It's so-and-so calling from so-and-so. Here's the number. Please call us back. Not even any detail, even if it's just a simple appointment that they missed. you can't leave any information. Spouses, children, grandparents, aunts, uncles, sisters, brothers, you can't do any of that. It is a complete violation. So unfortunately, I believe that the plaintiff wins in this case. But this is the first time I've actually recorded on here, and it feels really weird, but hopefully that's the best I can say. Okay? Thank you. Bye-bye.